Welcome back. It's great to have you with us on Point this afternoon. I'm Frances Hurd. Now, the World Economic Forum is hosting a COVID-19 discussion with experts from the World Health Organization and the World Food Programme. We brought you a snippet earlier. Let's take you live to that discussion for a little bit.
We're Pan-African magazine. I'd want that to be more specific on the Madagascar cure for COVID-19. What's the WHO doing? Have they taken this cure? Have they started looking at it more closely? And have they taken it to their labs to see if this cure is going to work? And if it's going to work, they should issue a public statement to the whole African countries to start using the cure. And how soon can we get a definite word from WHO Africa on the Madagascar cure? That is my question. Thank you.
I think that's heard loud and clear. And just to also emphasize that we've gotten a lot of questions about this Madagascar herbal medicine. So we know we've already addressed it twice, Dr. Moeti, in this call. But that question, to be more specific, could you answer that for us one more time? And then we'll go to Chris Nikoy, of course, on the question on food security from Adam. But Dr. Moeti, go ahead first.
Yes, thank you very much for that question. So to be specific, we have been in touch with the government of Madagascar. We have, our representative has, of course, spoken to the Minister of Health. She has had a meeting with the head of state. We have offered to support the design of a study to look into this product. We are in discussion with them about under what conditions this might happen, as I have said before. And I think this is as far as I can go. We are in contact with, speaking to the government. Our Director General is going to be speaking to the head of state. What we are also helping them to understand is that we would be very happy to work with them. I think it is a matter of working out some details of the conditions under which this might happen for us to reach out, to design how to look at this plant together. Understanding that in Madagascar, they do actually have scientists and researchers who would be very capable of doing this. So we are offering to work together with them so that we can make the kind of pronouncement that you're asking for based on data that will have been gathered about the efficacy of this Madagascar product.
Because
this is a specific.
Dr. Moeti, you don't have yet any data or evidence on the efficacy of this herbal medicine for Madagascar? No. Okay.
No, we do not. No, we do not.
Okay, I think that answers the question. Thank you so much. And then I want to see if we can go back to Chris Nikoy for the question about food security from Adam Vaughan. Chris, can you hear us and can you get to us on that question?
Thank you, Adam, for your question. I think the question, first, let me say, globally, today, the World Food Programme, okay, let me start from there and then we'll move to the broader issue, is providing assistance to something like 130 million people, of which about 30 million of this group are entirely dependent on WFP's assistance. That is where they get their daily food source from. Our estimates show that another 135 million globally could be added on who will be at the risk of not able to feed themselves if something is not done. Now, what are the issues in the food systems which are at risk because of the COVID? First is on the production side, all right? If you look at Africa, for example, most people who are producing food are smallholder farmers, and they tend to be the aged population because most of the young people move into cities. Now, if this aged population begin to be affected by this pandemic, it will have serious implications for food production going forward. I mean, if I look at West and Central Africa, we are now going to enter into the planting season. And just imagine if in most of rural Africa, older people who farm are falling ill. That's one. If you look at it on the broader global scale, what's happening is that basically trade is being disrupted because of uncertainty, which is different, you're right, which is quite different from what happened in the 2008-2009. By the uncertainty, people are trying to hold on to their supplies. Countries are limiting how much can be sold in terms of even health products and health supplies, and the same applies to food. Again, lockdowns in India and Asia, in other countries in Asia are affecting rice importers, etc., because how markets function require all these people to be moved around and being engaged in business. And this is not happening. We are monitoring what is the sort of inventories that countries have either in country or on sea, especially for food products that they import. And again, you will see, for example, let me just give an example. I was having a discussion with the Minister of Agriculture in Liberia, and beyond 4 months or 4.5 months, she didn't have any visibility on what else is coming, given again because of these uncertainties. So these are the things that can cause the disruptions, and that's why it's important that all measures that are taken by governments allow the supply chains and trades to function normally, because it is the cumulative effect of all this in the chain. And then when you come into the countries, disruptions in flows. And then lastly, let me just point out that we were earlier talking about the people, the daily wage earners, the people who literally live from hand to mouth. If these people, either because of the loss of their livelihoods, when we've seen riots in parts of Lagos and a few other cities around Africa, if this continues and people cannot have their livelihoods and governments are not able to quickly put in the social protection schemes that will ensure that they have some access to some funds to be able to buy, or they have access to food, it is this compounding effect that is going to create the serious food security problem. So essentially it is what needs to be done to ensure that food systems, the production, the distribution, its consumption, all the elements function properly. And the last word, if you permit me, is on young children between 6 months and 5 years, malnutrition. And let me just use the figures from just my region. 2018, we had something like 8 million kids under 5 who were malnourished. This year, having nothing to do with COVID, but just all the issues of conflict and other shocks, this figure is expected to rise to 12 million. And this is even before COVID. So again, if food systems are not functioning, if mothers cannot get access to reasonably priced, nutritious food for their children, etc., we are going to have a very serious malnutrition problem across the continent. Thank you.
Thank you, Chris. And I think we can try one last time to go to the minister in Rwanda. Let's see if we can hear you now. Minister, go ahead if you can hear us.
Yeah, hi, how are you, everyone? I think I have been following up on the questions, and I think issues that are being addressed there are real life issues, and this COVID-19. I think it's translating into food and nutrition issues, even the whole economy and livelihoods of people. And for us in Rwanda, we are just coming out of a 49-day complete lockdown, which is now relaxed from May 4th. And I think even before when this pandemic announced itself, it could be anticipated that it may be translated into food security problems given its transmission methods, but also the proposed containment measures. So for us as a country, when we announced the lockdown, the government of Rwanda immediately defined that the food value chains are among the essential activities the same level as health activities. And we defined the guidelines on how critical agriculture activities, input and output, supply chains, even food markets, how they continue to function while everyone is respecting the health guidelines. And activities that were to be that usually are conducted in communal setups, such as extension services, rural markets, and all of these things. They were twisted to use IT tools, and in the cases where people could not move, and the agricultural labor becoming bit scarce, the government assisted the farmers by providing mechanization support so that we make sure that the seasonal activities are not disturbed. And also our government, I heard WFP mentioning how the dairy people depending on dairy wages are being affected. It is true. They are heavily affected by lockdowns. So what we are doing as the government of Rwanda, we have extended food assistance from the national strategic reserves, and also purchasing some nutritious foods that are not having immediate markets, such as milk and eggs. And we support those who usually depend on dairy wages, or for the children of families, coming from the families with limited income.
Yeah.
But also, as we usually have social protection programs, we made sure that they continue functioning even if people were not working. And we just finished drafting our economic recovery plan, and our government made sure that food self-sufficiency become a very important component.
Very important.
There are issues that are coming out of
Minister, if I can
our reach.
just ask, because we're running out of time, but we do want to make sure that we get one last question also specifically for you. So I apologize to interrupt, but I think we have Christophe Hitayezu on the line, who is in Rwanda and who has a question for you. And I hope we can get to that and then close the meeting. Go ahead, Christophe.
Thank you very much. The horticulture subsector has been highly affected because the produce was used to be exported and also consumed in hospitality facilities. What are the innovative solutions that to maintain sustainable recovery of the subsector? But I had another question to Dr. Mowati.
Yeah, I'm afraid we won't be able to get to that anymore. So we'll get to the first question, Christophe, because I'm afraid we're running out of time. So, Minister, can you tell us a little bit more about your plans on that front?
Sure, yeah. I mean, horticulture production is one of the affected sector. And what we are doing is making sure that we are linking producers with the consumers, and so many IT-enabled traders have emerged. But for the exports, I think he knows that government made Rwanda weekly Rwanda flight to where we export our products, and it's still functioning. And we added the second flight of Ethiopian Airlines. So for the time being, we see our exports picking up. Thank you.
Thank you so much, Minister, and thank you to all of the other journalists that have dialed in, and of course to our other speakers, Dr. Mowati, Dr. Yao, and Chris Nikoy. That's all from us here in Geneva today. Thank you, and see you next time.